The next patient is a 30-year-old professional football player who's been complaining of ankle pain for the past 2 months. His pain is mostly in the posterior or the back of the ankle. Pain and discomfort is worse when he extends or flexes the ankle. Pain interferes with his game, especially when he runs. Patient states his problem developed after switching to a new different type of sneakers. This was mandated by the club that he was recently traded to. His past medical history is unremarkable, and he takes arthritic as an anti-inflammatory to help him with his pain. On exam, his Achilles tendon is very tender. Even the slightest touch or palpation makes him uncomfortable. The diagnosis of Achilles tendonitis was confirmed by physical exam and use of an ultrasound. Achilles tendonitis refers to the irritation and inflammation of the Achilles tendon, which is located in the back of the ankle. Pain and swelling are typical symptoms, but over the long run, the tendon can weaken, and rupture of the tendon is a serious matter, since it may cause chronic pain and disability. Typically, patients experience most of the pain during running and jumping. Changes in footwear and training schedules, as reported by this patient, could be a contributory factor to development of Achilles tendonitis. Treatment is RICE, which stands for rest, ice massage, compression, and elevation. Avoid injection of corticosteroids, which may be harmful in the case